Have a guest from the NDELA Osun State Command. And here with me in the studio is Dr. Yetunde Ofoha-Godwin, the Assistant State Commander, Drug Demand Reduction, NDELA Osogbo. I hope I pronounced the name well. You're welcome, ma.
Very well.
Oh, good one. You're welcome on the show, ma.
Thank you so much.
It's nice to have you here, ma.
Thank you so much.
Okay, before we dive into the interview, I would like to take this story.
Okay.
Yes, ma'am. NDLEA arrests pregnant women crippled in Edo with assorted illicit drug. This story is in Vanguard newspaper. Operative of the National Drug Law Enforcement Agency, NDLEA, at the Murtala Mohammed International Airport, Lagos, have arrested a pregnant woman, Rabetu Abdulrazak, 24, and a crippled Shehu Adamu in Agbede, Etsako, West Edo State, while over 14 kilograms of assorted illicit drugs, including cannabis, tramadol, swinol, were recovered from then on the 15th of April. The agency also intercepted consignment of tramadol, refinol, cannabis concealed in wind jackets and bottle of body cream. The psychoactive substances were recovered at the new terminal of the airport on the 14th of April following the arrest of a passenger, Josiah Sunday, who was traveling on a Qatar airline flight via Doha to Oman, Middle East. Doctor of Media and Advocacy Femi Babafemi said a thorough search of the suspect 2 black bags led to the discovery of 4.80 kilograms of cannabis concealed in a 3 winter jacket and various quantity of tramadol, refinol, in a bottle of lotion, a body lotion. That is just to launch us into the segment of what we'll be looking at this morning. We actually want to look at drug abuse and Nigerian youth. But actually, drug abuse has gone, with that story, it has gone beyond Nigerian youth. Even the old are into this illicit drug and even the business. So let's start with the way drug abuse had been in Nigeria with Nigeria youth. I have a statistic here of where the current health situation of Nigerian youth is worrisome on their engagement of hard drug. So let's start off with Nigerian youth and drug abuse first.
Thank you so very much, presenter. But before I delve into the question,
okay, ma'am,
I need to let the community, especially, I don't know where they are hearing us this morning,
all over the country,
all over the country, to let them know that Nigerian, through National Drug Law Enforcement Agency, we have joined the high rank of countries in global community concerning waging war against trafficking and abuse of drugs. And a lot of strategic efforts, especially since our new chairman, retired Major Brigadier Marabuba, came on board. Well, I just want us to understand that NDELA in the past 9 months, we have implemented a raft of measures, concerning curbing the illicit drug menace. For example, we have what we call NDCMP from the year 2021 to 2025. Now, that's a program to curb the trafficking, to curb drug abuse. So, what is NDCMP? Simply is an action plan on drug control, and it is very clear. It's a road mapping to address drug control issues in Nigeria. Now, go back to your problem. When there is no demand, there is no supply. And this is where the youth comes in. And the youth in the past were not really into the use of drug. But because of the risk factors in the country right now, when we're talking about the risk factors, we talk about the country itself, we talk about their parental background, we talk about the socio-economic problem in the Nigeria, we talk about a lot of things. It could be peer pressure. And we talk about also their own individual problem, personality. So that has been the major risk factor that has increased the use of abuse of substances among the youths in Nigeria. And even technology. We're talking about phone, access to phone. Because most of this trafficking now, you don't see the delivery face-to-face, you see delivery through phone. Thank you very much.
Okay, thank you so much, Ma, for that background, making us know that, okay, these are the steps that have been taken by the agency. So now let's look at the way the usage of drugs had become norms amidst Nigerian youth and students. It's like, as a guy or even ladies, it doesn't have to do with the gender anymore. Even both the male and female, we see like, if I've not done this, if I'm not taking this, I'm not man enough. I don't know what's up. I don't know what's going on. It's now become a norm that even in universities, when you go there now, most guys you hardly go to just a hostel, you hardly see just one person out of like maybe 50 or 20 rooms that are not into drugs. So what should we say could be, aside those things you listed, why has it become norms in our society, and what is the agency doing concerning this?
I want the society to know something, that substance use is like a behavior. You understand? It's like a behavior that is not healthy. And when we talk about substance use, there's something you have to remember relating to youth. You know, children, they copy what they see. They do what they read. And availability of drugs in the country right now, and also that they have learned that the only way to deal with the risk factors, the problems in their lives, is the use of drugs. Why? I'm going to cite an example. For example, in my daughter's school, that was a long time, she plays basketball, and one of the team leader brought tramadol, and she started distributing it. Say, let me tell you something, when you use tramadol, you're going to be strong. When it
helps you.
You know, any blow that is coming, you're not going to feel it.
Makes you energetic.
And because one thing, her father was a sportsman, and she has seen her father using tramadol. So her expectation is, or was, this is good. And when we look at the advertisements in the media, we're talking about alcohol that are even accepted in the society. I feel good. So good, so good, so good. We don't know that this thing it has a lot of side effects. You are drinking stout and you are jumping Mike Jordan, and they believe that, why can't I take stout so that I can jump over my problem? So these are the kind of things that, youth, especially adolescents, youths, we call it just a reason that made them to delve into the use of drugs.
Okay,
just overcome.
The way you went into that direction, you took me somewhere I didn't have intention of going. I've had conversation with someone who says that drug, especially weed, helps him overcome depression. Another person also said he doesn't eat well, so whenever he smokes, it helps him have appetite. I want you to shed more light on this, especially the use of weed in our society has really increased.
Thank you very much. Cannabis is a stimulant.
Okay.
It's a stimulant.
Yes.
And that is just a major reason. For example, we have a lot of advocacy, war against drug abuse, media, as we are doing today, in the community generally, in schools, in primary, in secondary, in tertiary, in non-governmental organization and government organization. Let me just tell you something. There was a scenario. I love using practical things because I've been working in NDELA for 29 years and I've been into drug demand reduction for 29 years. So I'm an expert. And not also that, I have seen a lot of things. We're into rehabilitation. Okay. A student is always sad, emotionally traumatized. And he saw another student always feeling high, feeling happy. And he asked, why are you always feeling happy? My father and my mother, they are always boxing each other every morning, and this is affecting me psychologically. I cannot concentrate. I cannot read. And they say, look at you. Poor you. Follow me. And he followed, he went to the dark room. And dark room is where they initiate. And he was given. And he smoked. And when he got home, when he saw his parents boxing each other, he wasn't care, he was just laughing. Because already he's on high. It's a stimulant. And also it could be depressant, because sometimes some of them, when they smoke, it makes them to be depressed. You see them staying alone, they don't want to mingle with anything. So weed is like a stimulant. They love using it because they have a reward of what they are looking for, and they're excited when they get the reward.
Okay, can we quickly talk about the effect that this drug usage has on our mental health, on our health generally, before we come back to our state level?
Like I said, substance use, we call it substance use because it's why we prefer substance use is that when maybe somebody comes in, unless the person is tested, then you know the kind of substance. Then we will not be able to identify this drug you are using. That's why when you hear me say substance use, I'm talking generally. Okay, you are talking about the effect. I cannot just, because of our time, I will just try to categorize. We have the physical effects, that when you see somebody using drugs, you'll be able to identify, you understand? And we have psychological effects, which can lead to mental instability, mood swing. And we have a social, on the family, on the society, and we have economic aspect. Because the more you delve into drugs, the more economically, it's so demanding. You have to meet up, you have to steal, and it's also affect what we call, when it comes to social, to moral is under it. Delinquency is one of these problems in the schools nowadays. Is as a result of drug use, raping, kidnapping, stabbing, stealing, juvenile delinquency is as a result of it. So, but because of our time, we'll not be able to pick it one by one. Already, I have categorized them. So it depends on the one that is affecting them. You will know that, physical effect, psychological effect, social effect, and economic effect. Thank you.
Okay, would love to come down to Osun State and the agency, how they've been functioning here in the state. I'll be passing the baton to Yusuf here with me.
Okay.
Well, thank you very much. Thank you for joining us. And thank for the honor and for honoring Honourable FM, where we actually use our honor to project the good in the society. Hope I'm correct.
You're welcome.
Yeah, Ma, I would like to, in the course of your response to our question, you talk about parental guide or care that actually has been the major issue that actually promoted this. In a nutshell, what you're saying is most of the drug addicts you see outside is as a result of their family or peer influence. I just want you to make clarification on that, Ma.
Because of recent experiences, I will call it, in relating to substance users, when you ask them, when they come with their parents, and you ask them, I've spent a lot of money, I did this, I did that on him, on her, he or she doesn't lack anything. Then when I ask my clients, what is the major problem? You see him pointing to his parents. They are the one. Number one, it could be as a result of problem at home, which has led to separation or divorce. Yoruba adage says, you cannot use one hand to take care of a child. It takes two. And when we're talking about two, it talks about a husband and a wife collaborating together to bring up these children in a godly way. But a child that sees parents fighting, a child that sees a father drinking, smoking, or he sees or she sees a mother smoking, drinking, what do you expect from such child?
He or she will actually follow
you copy and you do. I was able to rehabilitate a client, and when I was asking him question, the father was holier than holy. And he is a minister in the church. Immediately the father left. He said, don't mind him, he drinks.
Wow.
And I started, because he sends me to buy drinks. He sends me to buy drugs. So why won't I do it? Many of them, you say, oh yeah, go, run, go there and, and go and buy gin for me. Of course. What do you expect? And where peer pressure comes in, and this is where I'm going to hammer. You have a child you cannot take care of. You have 5, 10 children. You don't have the economic facility to take care of them. You just send them to school without, meeting their demands. And this is where peer pressure comes in. When they get to school, you look at yourself. I cannot meet up the demand on the educational expectation. What do you think? How you see your friends? You see the way they live. You see the way they dress. You see that they don't like anything. And this is where we have problem in schools through cultism.
Yeah.
In cultism, what they do is that if you want me to take care of you, you have to join. You have to be a member. You have to be initiated. And for a child that's his economic level is poor in the school, will he or she not join?
Definitely.
Definitely you join, because you know your needs are going to be what? Met. So that is just where peer pressure comes in. That is just it. Very simple. Very, very. It's not that they really want to do it, but they want, like I said, they want a reward. They want to meet their needs that their parents were not able to provide for. Thank you.
Let me quickly, since the assumption of the chairman and the CEO of NDELA now, General Buba Mara, retired, there have been a lot of reform, transformation in NDELA. In the past, the number of sites of seizure of illicit substance arrests, it was not as much as we experience now. And it has been all over that he came on board with different orientations for the officers and the activities of the NDELA across all formation. In Osun here, how has it been in the last 9 months? You talk about
9 months for
about I'm talking
the
about
national level. Okay,
national. I'm talking about the
in Osun State.
You are talking about the launch of the plan action.
Yes, and
you are talking about, like, 9 months ago it was launched and it has been systematically implemented. Yeah. How has that been implemented, and how would that have effect on an average youth in Osun, who, for example, now there are some areas in Osun that are endemic with this substance, and which I want to believe that NDELA is doing all it takes to actually nip it to above. How would that actually have effect on the youth populace of Osun, considering the fact that majority of these were just victim of circumstance? Is not what they actually started willing.
Risk factor. Thank you so much. Normally, what has been inaugurated nationally is to be implemented at the state level. And that is why NDELA is like a coin with two sides. We have the enforcement, we have the drug demand reduction, that I'm the assistant state commander for that, because we have the zonal commander. At the state level, in the resumption of office of the new state commander, even before the previous one, we have been into a lot of advocacies, not only on reduction. For example, let me start with enforcement now. This last week, NDELA Osun State, led by a senior officer, carried out a cannabis sativa destruction of about 20 kg in Osun State here. I'm not going to mention the name because of security purposes.
Yes,
and can you just imagine that a lot we've done concerning destruction of cannabis, sativa, farms, bonds, and not only that, a lot of arrests and seizures, which I know even the present governor of Osun State is aware about. Yes. But let me tell you something. The other aspect, if you remember what I said at the beginning of this program, I said, when there is no demand, there is no supply. And that is it. We have started an advocacy since the reception in the office of our chairman, chief executive, down to the state level. We have war against drug abuse. It's not fighting. It's not beating. We're talking about prevention. Because an English adage says, prevention is better than cure. What do we embark upon when it comes to prevention? Prevention simply means prevention of substance use. That is carrying out the message to the grassroots to let them know what substance use is about. To let them know, starting from the socially accepted drugs. We call them socially accepted drugs. They're socially accepted in the community. You can drink in the community. You can smoke cigarette in the community. You can take coffee in the community. You can chew goro. You can chew cola nut in the community. Community will not frown. NDELA will not after you. But they are gateways. Because by the time you start using the socially accepted drugs and they cannot meet your reward, then you go higher. You understand? Yeah. And that is why we're trying to let them know that it's better you don't start. Because when you start, it will take the grace of God for you to stop. And that is why when they come for treatment, there is relapse. They relapse. And somebody coming to rehab can come up to 3-4 times. Spending 3 months, 6 months, a year. Repeating. You understand? Rehabilitation. And that is why we embarked upon WADA. WADA carrying out the message. As we are doing this money, print, media, we carry it to schools, primary, secondary, tertiary, government organization, non-government organization, Okada drivers, all the drivers, traditional rulers, hairdressers, so many of them. You understand? So that is what we're trying to do, to sensitize them about the use and dangers. To be forewarned is to be forearmed. We only sensitize parent teachers associations in schools. For example, now we're going to have a program with one of the school in Osun State, PTA. We always encourage them, call us. We need to let the parent know, so the problem is yours, not these children. Because if the foundation is destroyed, there's nothing these children can do. There's going to be a problem. Thank you so very much. We've done so much. And let me tell you our programs for this week. Today, we're here. Tomorrow we're going to be at Adeleke University. On Wednesday, we're going to be at the School of Nursing. On Thursday, I'm going to be Ire. You see? On Friday, we go to mosque.
Other security agencies, we talk about enforcement. In the process of enforcement, the miscreants or those indulging in the use of these illicit drugs might want to attack your officers. I don't know if your command have synergy with other security agents to ensure that, yes, even when they want to try to actually breach or go violently on the officers, is there any collaboration? Because I could recall vividly, there was a time your office with Amotekun, Osogbo Amotekun.
I was there.
Yes, I remember vividly you were there with the Fountain University students, right? Yes. I'm just trying to buttress the point you've made that you've been collaborating. But that day it was just Amotekun. And the constitutional rule of Amotekun is only limited to the states, and they are not bearing harms, and they are not fully harmed. So I just want to know if there is any synergy or collaboration between relevant security operatives to ensure that the integrity and sovereignty of the agency is protected.
It's a war.
Yes.
When you want to fight a war, you don't fight a war alone.
Yes.
We have some experts. NDELA has been in existence since 1989, but at the same time, we have some paramilitaries that they have been before us, and they are well equipped. NDELA is well equipped and charged. I just want us, the people, to know that we work with the paramilitaries, we work with army, we work with policemen. You understand it now? Because when we are going for any arrest, or we're going for any, what do I say now? We're going for any
enforcement
arrest that is very serious. You know, the cartel, you know, you don't just take them away like that. You have to reinforce yourself. We go in team so that the arrest can be successful without casualties. But it's because it's an internal, you know, we don't broadcast it because you don't do such things. That's why. But why you saw us with Amotekun that day is because it was a road walk. It was a road walk. Yeah. And the person that was handling the program invited Amotekun. I told you work with NGOs too. And he invited us to come and deliver lecture. So it was not really NDELA program, but we collaborated with him to make it a successful program. That was it.
Okay, Ma, I don't want to bother you with more questions because of our time.
Okay.
I just want you to speak to parents, young Nigerians.
Okay.
More or less like a word of advice on this illicit drug. Because some have actually seen this as the only escape route that can actually save them from the trauma or the sleepless night or whatsoever they are facing. I've had during the program, the Amotekun program we're actually talking about, I followed them during the exercise, and a week after the program, I had a conversation with someone where he was actually relaying his experience about the program, that the program have actually forced him to actually checkmate his use of this illicit drug, which, as a person, I don't know that he actually indulged in that kind of heart. I never knew, or I never thought he could, but he opened up. That's just by the way. But what would be your own message or word of advice to parents out there who do all sorts of things in the presence of their words, who don't see it as a crime to actually smoke or drink? Even as we are actually in the period of Ramadan fast, we had issue of parents, someone that actually fasted since morning till evening, will send their word, a little boy, to go and get them cigarettes.
Yeah.
To go and get them all this dry gin. What will be your message to them?
I want to advise parents, because I'm a parent too. Actually, not all parents, but most parents are very careless with their children upbringing. You see, they left these children in the hands of house helps, of housekeepers. They left them with uncles and aunties, and they run after money. They run after their career. They run after one thing or the other, not knowing that the young of today surely becomes the leaders of tomorrow. And as family is minute, a unit, family makes a nation. You understand what I'm saying now?
Yes,
so it is what the family now produces that the nation will do what? We produce. So when we are saying this and this country is bad, it's from us. It's from we parents. But one thing I want to tell them, one of the United Nations team in past years said, listen first. It's one of the team. So I'm just trying to advise parents, listen to your children. When your children has complained, you are sleeping, he or she comes into the bedroom and knocks the door. Wake up from bed and say, what is it you want to tell me? Maybe he has been traumatized because of bully at school. And he wants or she wants to express himself or herself that, oh, mom, I've been bullied. I have problem with my personality. Listen. Don't say you are busy. When you are about to get into the vehicle, going to work and say, mom, can I have a child? Dad, can I have a child? Listen. Don't just brush it away. Listen first. Was tested scientifically, and it was realized that most parents that listen to their children attentively, they have good results in the behaviors and the morals of their children. But those ones that are not challenged, they have the problem. So that is it. And number two, I just wanted to tell them that please, whatever you do in the presence of these children, they practicalize it later on. And don't set them to buy drugs, because you are actually destroying your future. When you're supposed to eat the fruits of your labor, you begin to receive cane and debt from these children. All for the youths, you are the future leader of tomorrow, future leader of Nigeria. You have a goal, you have a dream, and God has invested so much. He's giving you wisdom, capabilities, abilities, and the only way to manifest or to put them to the world, to show the whole world that you are capable, is you do away with drugs. Because if you delve into it, it's going to shatter your dreams, it's going to kill your goals, you will now become a failure in life. So please, I want to say something. If you have problems with your child, you can visit Osun State Command Drug Demand Reduction. You ask for drug demand reduction. I wouldn't say that we are perfect, but because we have experts, professionals, like myself, I studied counseling for master's, then clinical psychology for PhD, and other in the department, they are counselors. We have experts. What you don't know, you don't give. And that is just it. So please check, put these things into, what will I say? Just write it down. And when you see your children misbehaving, don't curb them. Don't cover them. Speak out. Speak out. Look for help, and you will get the help you want. Thank you.
Quickly, ma, I don't know if there's any number, if those are actually listening might want to reach out to NDELA office, or any contact they actually reach out to you through that, ma.
Well, let me just say something now. Let me give them my number.
Okay.
Because I work with a drug demand reduction unit. If you call me, I will reach out to the commander. So that is it. But condition, don't call me at night. Don't call me when I'm supposed to be sleeping.
It's even very important. Probably it's just send you text, not to call.
I think I would love that.
Text message.
No, if it's sometimes when something is really burning and you won't know the time you will die. But don't call me at odd times.
Okay.
You call me starting from 10 a.m. to 4 p.m. only during work time.
Okay.
Anything outside work, I need to rest too. The team too, we have our own family. 10 a.m. to, let me extend it to 5 p.m.
Okay.
Yes.
The number, ma.
080.
Okay, 080
37
17
40 43. And be clear, I don't want shouting. I'm a Brooklyn, useless. No, please be comforted, please.
Thank you, Doctor. Thank you for honoring us at Honourable FM, and thank for the enlightenment and our departing word. And what I've actually picked from here is, as a parent, you must have a listening
yes.
here. And as a young person, the leader of tomorrow, tomorrow is today. Tomorrow is now. You must take responsibility and not indulge in the use of any illicit drug. Similarly, our time is fast spent. If I have anything to say from my own end, I think I'm cool.
You're cool. Okay, big thank you to everyone that joined us on the show today. Our time is fast spent. A big thank you to you, Dr. Yetunde Ofoha-Godwin, and a big thank you to you too, Mrs. Mercy. Thank you for joining us in the studio today. We hope we'll call you next time. You honor Honourable.
Of course, we love you. We are grateful.
Thank you so much, ma.
Let me just say, we didn't pay any money. You call, we're supposed to pay. It's an honor. We love you.
Thank you so much.
And we work with you anytime. Any of our programs, we call you.
Thank you so much, ma. Okay, our listeners at home, please let's do this again tomorrow. Same time, same station, 10 a.m. to 11 a.m. Please enjoy the rest of your day and do stay out of trouble. On this note, we're saying bye-bye.